Hi, I'm Dr. Ranjani Rao, practicing general dentist and an implantologist in Electronic City, Bangalore. We run two state-of-the-art dental centers in the region of Electronic City. We've been doing this for the last 15 years. It's very common that patients come with a tooth cracked or broken into two pieces and excruciating pain, and they walk in. It sometimes happens in the middle of the night, sometimes it would have happened while they were eating something hard like a stone or a piece of bone that turned out to be harder than normal, and they bit on it, or they were biting into a nut or things like that, and the tooth broke. Now there are two scenarios. It could have happened that there is an oblique crack and only a portion of the crown is fractured, and the pain is because of the mobile fragment, and every time they bite, patient experiences severe pain. In this case, it's very easy to remove the broken fragment and then we can restore the tooth. It can be built up using root canal, requiring a crown. There's several ways of doing it. However, if the crack is propagated through and through and the tooth is split into two, most often than not, there's very little that we can do. We have to extract the tooth, remove it completely. However, your doctor has a couple of options. If you reach them on time and if he's able to explain to you and get the tooth out and put in an implant on the same day, remember, we would have then saved extremely valuable and precious bone, which we will otherwise lose if you come back a few years later to get the replacement done. So an immediate implant is an ideal option if the tooth cracked and there was no decay or infection and you went to the dentist at the earliest. So it's extremely important that you get to your dentist at the earliest.